Chapter 6: Health and Wellness. Health is a multidimensional concept that must be viewed in a broader sense than good health, wellness, or the absence of disease. Models of health offer a perspective from which to understand the relationships between health, wellness, and illness. Nurses who understand how patients react to illness can minimize the effects of illness and help patients and their families maintain or return to their highest level of functioning. Healthy People Documents. The U.S. government set national health care goals back in 1979, with the publication of Healthy People, the Surgeon General's Report on Health Promotion and Disease. The report outlined priority objectives for preventive services, health protection, and health promotion that addressed improvements in health status, risk reduction, public and professional awareness of prevention, health services and protective measures, surveillance, and evaluation. Healthy People provides evidence-based, 10-year national objectives for promoting health and preventing disease. Since then, 3 more documents have been developed to identify and address healthcare needs: Healthy People 2000, Healthy People 2010, and Healthy People 2020. Healthy People 2000 identified health improvement goals and objective to be reached by the year 2010. Healthy People 2010 served as a roadmap for improving the health of all people in the United States. This edition emphasized the link between individual and community health and the premise that the health of communities determines the overall health status of the nation. Healthy People 2020 promotes a society in which all people live long, healthy lives. There are 4 overarching goals. 1. Attain high-quality, longer lives free of preventable disease, disability, injury, and premature death. 2. Achieve health equity, eliminate disparities, and improve the health of all groups. 3. Create social and physical environments that promote good health for all. And 4. Promote quality of life, healthy development, and healthy behaviors across all life stages. Case study: Jack is a 59-year-old man with a history of type 2 diabetes, hypertension, and obesity. He is married and works 50 to 60 hours per week in a computer technology position. His wife works the same number of hours, although she tends to travel more with her job and sometimes works the night shift. As a result, both Jack and his wife have a hard time fitting exercise into their daily routine, and they often eat in restaurants. What hurdles need to be overcome for Jack to adopt a healthier lifestyle? And what could you do as a nurse to encourage behavior changes? Jack has existing medical conditions, which means a healthier lifestyle is a priority. The demands of his job makes eating a well-balanced diet and incorporating an exercise plan into his routine difficult. The nurse is in an ideal position to educate Jack about the importance of eating healthy and regular exercise. Teaching should promote and encourage this healthier lifestyle as well as provide valuable resources to accomplish this goal. Definition of health. The World Health Organization defines health as a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. It is also a state of being that people define in relation to their own values, personality, and lifestyle. Individual views of health vary among age groups, genders, races, and cultures. To help patients identify and reach health goals, Nurses discover and use information about their concepts of health. Nurses need to consider the total person and the environment in which the person lives in order to individualize nursing care and enhance meaningfulness of the patient's future health status.
Models of health and illness. A model is a theoretical way of understanding a concept or idea. Models represent different ways of approaching complex issues. Because health and illness are complex concepts, models are used to understand the relationships between these concepts and the patient's attitudes toward health and health behaviors. Health beliefs are a person's ideas, convictions, and attitudes about health and illness. They may be based on factual information or misinformation, common sense or myths, or reality or false expectations. Because health beliefs usually influence health behavior, they can positively or negatively affect a patient's level of health. Positive health behaviors are activities related to maintaining, attaining, or regaining good health and preventing illness. Negative health behaviors include practices actually or potentially harmful to health. What are some examples of positive and negative health behaviors?
Common positive health behaviors include immunizations, proper sleep patterns, adequate exercise, stress management, and nutrition. Negative health behaviors include practices actually or potentially harmful to health such as smoking, drug or alcohol abuse, poor diet, and refusal to take necessary medications. Health Belief Model. Rosenstock's and Becker and Mayman's health belief model addresses the relationship between a person's beliefs and behaviors. The health belief model helps you understand factors influencing patients' perceptions, beliefs, and behavior to plan care that will most effectively help patients maintain or restore health and prevent illness. This model has three components: an individual's perception of susceptibility to an illness, an individual's perception of the seriousness of the illness, and the likelihood that a person will take preventive action. A patient's perception of susceptibility to disease and the patient's perception of the seriousness of an illness help to determine the likelihood that the patient will or will not partake in healthy behaviors. Health Promotion Model. The health promotion model defines health as a positive, dynamic state, not merely the absence of disease. Health promotion is directed at increasing a patient's level of well-being. The model focuses on the following three areas: 1. Individual characteristics and experiences, 2. Behavior-specific knowledge and effect, and 3. Behavioral outcomes, in which the patient commits to or changes a behavior. Health-promoting behavior is the desired behavioral outcome and the endpoint in the health promotion model. Health-promoting behaviors result in improved health, enhanced functional ability, and better quality of life at all stages of development. Please review Box 6.1, Focus on Older Adults, Health Promotion, as a supplement to this PowerPoint.
Maslow's hierarchy of needs is a model that nurses use to understand the interrelationships of basic human needs. According to this model, certain human needs are more basic than others. As a result, certain needs must be met before others, such as fulfilling the physiological needs before the needs of love and belonging. The hierarchy of needs model provides a basis for nurses to care for patients of all ages in all health settings. However, when applying the model, the focus of care is on a patient's needs rather than on strict adherence to the hierarchy. To provide the most effective care, You need to understand the relationships of different needs and the factors that determine the priorities for each patient. Healthcare has begun to take a more holistic view of health by considering emotional well-being, spiritual well-being, and other dimensions of an individual to be important aspects of physical wellness. In this model, nurses using the nursing process consider patients to be the ultimate experts concerning their own health, and respect a patient's subjective experience as relevant in maintaining health, or assisting in healing. In the holistic health model, patients are involved in their healing process, thereby assuming some responsibility for health maintenance. Nurses use holistic therapies either alone or in conjunction with conventional medicine.
Some examples of holistic or complementary and alternative interventions include meditation, music therapy, reminiscence, relaxation therapy, therapeutic touch, and guided imagery. Jack comes to the clinic today for routine follow-up for his diabetes. Jack's laboratory data reveal that his blood glucose level is consistently running high. His blood pressure is on the high side of normal. Sally, the diabetes nurse educator, is working with Jack for the second time. Sally knows she wants to find a way to get Jack's blood glucose levels down to avoid the long-term complications of diabetes. What do you think Sally plans to do? Sally plans to talk with Jack to determine his understanding of diabetes and to evaluate his readiness for the lifestyle behavior changes needed to manage his health. Variables influencing health and health beliefs and practices. Many variables influence how a person thinks and acts. Health beliefs can negatively or positively influence health behavior or health practices. Understanding the effects of these variables allows you to plan and deliver individualized nursing care. Time for a quick quiz. According to Maslow's hierarchy of needs, which of these needs would a patient seek to meet first? A. Self-actualization. B. Self-esteem. C. Shelter. Or D. Love and belonging. The answer is C. Shelter. Rationale. According to this model, physiological needs must be fulfilled before others. Internal variables include a person's developmental stage, intellectual background, perception of functioning, and emotional and spiritual factors. The nurse considers the patient's level of growth and development when using health beliefs and practices as a basis for planning care. A person's thoughts and behavior patterns change throughout life. A person's beliefs about health are shaped in part by the person's knowledge, lack of knowledge, or incorrect information about body functions and illnesses, educational background, traditions, and past experiences. These variables influence how a patient thinks about health. In addition, cognitive abilities shape the way a person thinks, including the ability to understand factors involved in illness and apply knowledge of health and illness to personal health practices. Cognitive abilities also relate to a person's developmental stage. When you assess a patient's level of health, gather subjective data about the way the patient perceives physical functioning such as level of fatigue, shortness of breath, or pain. Then obtain objective data about actual functioning such as blood pressure, height measurements, and lung sound assessment. This information allows you to more successfully plan and implement individualized care. The manner in which a person handles stress throughout each phase of life influences the way he or she reacts to illness. A person who generally is very calm may have little emotional response during illness, whereas another individual may be unable to cope emotionally with the threat of illness and may overreact or deny the presence of symptoms and not take therapeutic action. Spirituality is reflected in how a person lives his or her life, including the values and beliefs exercised, the relationships established with family and friends, and the ability to find hope and meaning in life. Religious practices are one way that people exercise spirituality. Some religions restrict the use of certain forms of medical treatment.
External variables influencing a person's health beliefs and practices include family practices, socioeconomic factors, and cultural background. The way that patients' family uses health care services generally affects their health practices, their perceptions of the seriousness of diseases, and their history of preventive care behaviors, or lack of them, influence how patients think about health. Social and psychosocial factors increase the risk for illness and influence the way that a person defines and reacts to illness. Psychosocial variables include the stability of the person's marital or intimate relationship, lifestyle habits, and occupational environment. Social variables partly determine how the health care system provides medical care. The organization of the health care system determines how patients obtain care, the treatment method, economic cost to the patient, and potential reimbursement to the health care agency, or patient. Like social variables, economic variables often affect a patient's level of health by increasing the risk for disease and influencing how or at what point the patient enters the health care system. Cultural background influences beliefs, values, and customs. It influences the approach to the health care systems, personal health practices, and the nurse-patient relationship. Cultural background also influences an individual's beliefs about causes of illness and remedies or practices to restore health. Please review Box 6.2, Cultural Aspects of Care. Cultural health beliefs, as a supplement to this PowerPoint.
Case study continued. Because Jack occasionally exercises, Sally decides to focus her teaching on the importance of routine exercise to improve Jack's health and help with the management of diabetes. Sally finds out that 6 months ago, Jack was using his treadmill for 20 minutes on most mornings. Since then, he has gotten out of the habit because he now tries to arrive at work 30 minutes earlier. What outcomes would you design for this encounter? An expected outcome would be, by the end of the visit, Jack will verbalize 2 reasons why it is helpful for him to stay physically active and 1 new strategy for exercise that he is willing to try. Time for a quick quiz. After evaluating a patient's external variables, the nurse concludes that health beliefs and practices can be influenced by which of the following? A. Emotional factors, B. Intellectual background, C. Developmental stage, or D. Socioeconomic factors. The answer is D. Socioeconomic factors. Rationale: emotional factors, intellectual background, and developmental stage are internal factors, not external factors. Health promotion activities help maintain or enhance health. Wellness education teaches patients how to care for themselves. Illness prevention activities protect against health threats and thus maintain an optimal level of health. These activities can be passive or active. Individuals learn passive strategies from others without their own participation. Active strategies motivate the individuals to adopt health programs. Immunization programs are an example of illness prevention. Routine exercise and good nutrition are examples of health promotion. Physical awareness, stress management, self-responsibility are examples of wellness education. The goal of a total health program is to improve a patient's level of well-being in all dimensions, not just physical health. Total health programs are based on the belief that many factors can affect a person's level of health. Healthcare professionals who work in the field of health promotion use proactive attempts to prevent illness or disease. Health promotion activities are passive or active. With passive strategies of health promotion, individuals gain from the activities of others without acting themselves. The fluoridation of municipal drinking water and the fortification of homogenized milk with vitamin D are examples of passive health promotion strategies. With active strategies of health promotion, individuals adopt specific health programs. Please review Box 6.3, Evidence-Based Practice, Health Promotion Strategies, as a supplement to this PowerPoint. Levels of preventative care. Nursing care oriented to health promotion, wellness, and illness prevention is described in terms of health activities on primary, secondary, and tertiary levels. Primary prevention aimed at health promotion includes health education programs, immunizations, nutritional programs, and physical fitness activities. Secondary prevention is delivered in homes, hospitals, or skilled nursing facilities. Tertiary prevention aims to help patients achieve as high a level of functioning as possible. This level of care is called preventive care because it involves preventing further disability or reduced functioning. Please review Table 6.1, 3 Levels of Prevention, as a supplement to this PowerPoint. Time for a quick quiz. You will use the concept of primary prevention when instructing a patient through which of the following: A. Get a flu shot every year. B. Take a blood pressure reading every day. C. Explore hiring a patient with a known disability. Or D. Undergo physical therapy following a cerebrovascular accident. The answer is A. Getting a flu shot every year. A risk factor is any situation, habit, or other variable such as social, environmental, physiological, psychological, developmental, intellectual, or spiritual that increases the vulnerability of an individual or group to an illness or accident. Genetic and physiological factors, such as being overweight, affect physical functioning of the body. Heredity, or genetic predisposition to specific illness, is a major physical risk factor. Age affects a person's susceptibility to certain illnesses. For example, premature infants and neonates are more susceptible to infections, and as a person ages, the risk of heart disease and many types of cancers increases. The physical environment in which a person works or lives can increase the likelihood that certain illnesses will occur. Environment includes things like cleanliness, heat, cold, overcrowding, and air quality. Lifestyle practices and behaviors have positive or negative effects on health. Some negative lifestyle practices that impact health include sunbathing, smoking, severe and prolonged stress, and an unhealthy diet. The nurse should discuss health hazards with the patient following a comprehensive nursing assessment, then help the patient decide if he or she wants to maintain or improve his or her health status by taking risk reduction actions. Understanding the process of changing behaviors will help you support difficult health behavior changes in patients. It is believed that change involves movement through a series of stages. These stages include 1. No intention to change called pre-contemplation. 2. Considering a change within the next 6 months called contemplation. 3. Making small changes known as preparation. 4. Actively engaging in strategies to change behavior called action. And 5. Maintaining a changed behavior known as the maintenance stage. As individuals attempt a change in behavior, relapse followed by recycling through the stages frequently occurs. When relapse occurs, a person will return to the contemplation or pre-contemplation stage before attempting the change again. Relapse is a learning process, and people can apply the lessons learned from relapse to their next attempt to change. Most behavior change programs are designed for and have a chance of success when people are ready to take action regarding their health behavior problems. Changes are maintained over time only if they are integrated into an individual's overall lifestyle. Maintaining healthy lifestyles can prevent hospitalizations and potentially lower the cost of healthcare. Please review Table 6.2, Stages of Health Behavior Change, as a supplement to this PowerPoint. Case study continued. Sally wants to apply the stages of behavior change with Jack. By using this model, she will work with Jack regarding what he is ready to do rather than simply telling Jack to be more active. To do this, she first asks Jack how he feels about exercise and what his plans are. Jack states, "I know that exercise would be good for me and I should probably work on it." This tells Sally that Jack is at the contemplation stage. How should Sally respond to the knowledge that Jack is at the contemplation stage? Sally targets her teaching to help Jack see the benefits of exercise, how it could fit into his schedule, and what kinds of things he likes to do. Sally asks Jack to bring a list of benefits of exercise, and 3 or 4 options for exercise to their next appointment. By this process, she hopes to move Jack into the preparation stage of behavior change for exercise at their next visit. Patient teaching, lifestyle changes. Objectives include the patient will reduce health risks related to poor lifestyle habits through behavior change. Teaching strategies include the nurse providing active listening technique, asking the patient about perceived barriers, assisting the patient in establishing goals, and reinforcing the process of change. Have the patient track adherence to evaluate progress, and be sure to provide positive reinforcement. Stress the importance of setting a goal when teaching lifestyle changes. Use written resources that are at an appropriate reading level. Ensure that educational materials are culturally appropriate. Include family members to support the lifestyle change. Please review Box 6.4, Patient Teaching, Lifestyle Changes, as a supplement to this PowerPoint. Acute and chronic illnesses are 2 general classifications of illness used in this chapter. Both acute and chronic illnesses have the potential to be life-threatening. An acute illness is usually reversible, has a short duration, and is often severe. The symptoms appear abruptly, are intense, and often subside after a relatively short period. An acute illness may affect functioning in any dimension. A chronic illness persists, usually longer than 6 months, is irreversible and affects functioning in one or more systems. Patients often fluctuate between maximal functioning and serious health relapses that may be life-threatening. Many chronic illnesses are related to 4 modifiable health behaviors: physical inactivity, poor nutrition, use of tobacco, and excessive alcohol consumption. Patients with chronic diseases and their families continually adjust and adapt to their illnesses. How an individual perceives an illness influences the type of coping responses. In response to a chronic illness, an individual develops an illness career. The illness career is flexible and changes in response to changes in health. Interactions with health professionals, psychological changes related to grief, and stress related to the illness. Time for a quick quiz. Sally has decided to set aside 30 minutes a day to walk after work next week. Sally is in what stage of risk factor modification? A. Pre-contemplation. B. Contemplation. C. Preparation. D. Action. Or E. Maintenance. The answer is C. Preparation is making small changes in preparation for a change in the next month. Illness behavior. People who are ill generally act in a way that medical sociologists call illness behavior. It involves how people monitor their bodies, define and interpret their symptoms, take remedial actions, and use the resources in the healthcare system. How people react to illness varies widely. Illness behavior displayed in sickness is often used to manage life adversities. In other words, if people perceive themselves to be ill, illness behaviors become coping mechanisms. Internal and external variables influence both health and health behavior and illness behavior. The influences of these variables and a patient's illness behavior often affect the likelihood of seeking health care, compliance with therapy, and health outcomes. Internal variables, such as patient perceptions of symptoms and the nature of the illness, influence patient behavior. If patients believe that the symptoms of their illnesses disrupt their normal routine, they are more likely to seek health care assistance than if they do not perceive the symptoms to be disruptive. Patients are also more likely to seek assistance if they believe the symptoms are serious or life-threatening. External variables influencing a patient's illness behavior include the visibility of symptoms, social group, cultural background, economic variables, accessibility of the healthcare system, and social support. A patient with a visible symptom is often more likely to seek assistance than a patient with no visible symptoms. Families, friends, and co-workers all potentially influence patients' illness behavior. Because of economic constraints, some patients delay treatment and in many cases continue to carry out daily activities. The physical proximity of patients to a healthcare agency often influences how soon they enter the system after deciding to seek care.
Illness is never an isolated life event. The patient and family deal with changes resulting from illness and treatment. Each patient responds uniquely to illness, requiring you to individualize nursing interventions. The patient and family commonly experience behavioral and emotional changes and changes in roles, body image and self-concept, and family dynamics. Individual behavioral and emotional reactions depend on the nature of an illness, a patient's attitude toward it, the reaction of others to it, and the variables of illness behavior. Short-term, non-life-threatening illnesses evoke few behavioral changes in the functioning of a patient or family. Severe illness, particularly one that is life-threatening, leads to more extensive emotional and behavioral changes such as anxiety, shock, denial, anger, and withdrawal. Body image is the subjective concept of physical appearance. Some illnesses result in changes in physical appearance. Patients' and families' reactions differ and usually depend on the type of changes, such as loss of a limb or an organ, their adaptive capacity, the rate at which changes takes place, and the support services available. Self-concept is a mental self-image of strengths and weaknesses in all aspects of personality. Self-concept is important in relationships with other family members. For example, a patient whose self-concept changes because of illness may no longer meet family expectations, leading to tension or conflict. As a result, family members change their interactions with their patient. People have many roles in life such as wage earner, decision maker, professional, child, sibling, or parent. When an illness occurs, parents and children try to adapt to the major changes that result. Role reversal is common. As a result of the effects of illness on the patient and family, family dynamics often change. Family dynamics are the processes by which the family functions, makes decisions, gives support to individual members, and copes with everyday changes and challenges. The nurse views the whole family as a patient under stress, planning care to help the family regain the maximal level of functioning and well-being. Case study continued. Teaching strategies include: practice active listening and determine what Jack understands regarding health risks related to poor lifestyle. Ask Jack what barriers and benefits he perceives with the planned lifestyle change of consistently exercising. Help Jack set achievable goals for change. Work with Jack to establish realistic timelines for modification of exercise habits.
Additional teaching strategies include: 1. Reinforce with Jack the process of change. 2. Use written resources at an appropriate reading level. 3. Include Jack's wife to support the lifestyle change. And 4. Identify community resources available to Jack such as walking track, fitness facilities, etc. At the next appointment, Jack says, "I saw there was a sale on walking shoes. If I'm going to start walking, do you think I need to get new shoes? Next week, I am taking a week of vacation, just doing things around the house, and I thought this would be a good time to start." Which stage of the stages of behavior model best describes Jack's desire to change?
Based on Jack's statement, Sally can determine he is in the preparation stage.
To evaluate progress, have Jack maintain an exercise log to track adherence, and provide positive reinforcement. Ask Jack to discuss his success with lifestyle changes, such as minutes spent in activity. Have Jack identify community resources used in making a change.
Caring for yourself. Nurses are particularly susceptible to the development of compassion fatigue and the subsequent problems of secondary traumatic stress and burnout. Compassion fatigue develops as a result of the relationships that nurses develop with their patients and families, whereas burnout stems from conflicts or nurse job dissatisfaction within the work setting. Compassion fatigue and burnout frequently affect a nurse's health and often leading to the following: 1. A decline in health. 2. Changes in sleep and eating patterns. 3. Emotional exhaustion. 4. Irritability. 5. Restlessness. 6. Impaired ability to focus and engage with patients. 7. Feelings of hopelessness. 8. Inability to take pleasure from activities. And 9. Anxiety. It is important for nurses to engage in personal and professional strategies to help combat compassion fatigue and promote resiliency. Personal strategies focus on health-promoting behaviors and healthy lifestyle choices. In an effort to combat secondary traumatic stress and burnout, you need to eat a nutritious diet, get adequate sleep, engage in exercise and relaxation activities, establish a good work-family balance, and engage in regular non-work activities. Other strategies include developing coping skills, allowing personal time for grieving the loss of patients, and focusing on one's own spiritual health. It can also help to find a mentor or an experienced nurse who understands the stress of the job and can help you identify coping strategies.